witchy. So, you have all sorts of hippie witchy shit on the table. And witchy make people uncomfortable, spiritual. And so on the table, you have essential oils and cotton balls. Use them. They are a great way to relax yourself. There's more scents on the relaxation table. There's also inspirational quotes. I'm like, whoever wants to take them at the end of the day, if you feel inspired, if they're like, that one speaks to me, go for it, grab it. You have notebooks that you can use to jot down thoughts, feelings, anything that comes up, stuff that you want to process. We'll also be using those throughout the day. The sticky notes, the post-it notes, if there is something that comes up for you that like, I want to make sure we talk about this, write it down on a sticky note, we can add it to the parking lot so that we can get back to it. If there's something that you truly appreciate that happens throughout the day, write it on a sticky note, add it to the appreciation post-it. The back table has vision board stuff, coloring sheets with coloring pencils. So recognizing that everybody processes differently and some people need to keep their hands busy. So if you're one of those people, please feel free to go grab a coloring sheet, some color pencils, and then color while you're listening.
And we will have time for a vision board activity, so there you go.
Yes, we're going to do the vision board activities after you. All right, any questions? Anything I forgot? Oh, and the playlist that you'll be hearing playing on break time is a Spotify list that you all will be emailed. So Elena, myself, and Chante literally cultivated this list based on our own feeling and wanted to share.
Yeah, so the ratchet songs y'all can blame on me. Thank you, Kevonya. Hopefully everybody's, what's going on with my back table? Where, oh, okay.
Oh, and we did have a couple of folks join, so like,
No, I appreciate you all being here. That's what I should have called out first. Thank you all for being on time. Now, I don't know where the rest of your pod is over there, but.
we had people join, so there's no
There's only 2 more people and they just got in like first thing this morning.
Oh, okay,
So I'm gonna
fair.
set my table now.
Grace, thank you. All right, okay, so appreciate y'all being here. Welcome back. Appreciate the great conversation. Hopefully everyone who wanted coffee got coffee. I know that was the situation today, so. We're gonna continue on wellness, and then I'll probably still give a 2-minute break before we go. I know I'm breaking rules, I'm sorry. But we'll have that as well. Okay, so we're gonna finish up talking about wellness, and I'll finally explain some of those worksheets. Oh, the other thing, so those bracelets are you all's to keep and have. So there's little affirmations. You can trade, if you want a particular color, maybe somebody will trade with you. And we have a couple extra ones I might give out for different reasons. I don't know. We'll see what happens. Did everyone get bracelets though? And does everyone have packets? Because I know we have new folks that join. If you don't have a packet, raise your hand. All right, so everyone has their bracelets on. Okay, awesome. Okay, so there we go. Okay, so some of you all started talking about this already in terms of self-care. And if you were in one of our previous virtual sessions, we talked more about the aspects of wellness. I'm going to breeze by it a little bit, but you do have those worksheets, and there's also resources in your guide as well on this. So this is the wellness wheel according to SAMHSA. So basically, we have various aspects, thank you, of wellness, and we can develop our wellness plan, our self-care plan, keeping in mind those various aspects. So we talked a little bit about professional or occupational wellness. We've talked a bit about physical wellness. Environmental wellness is being able to be in stimulating environments. So we talked a little bit about that, grounding environments. Intellectual, Being able to have creative pursuits. Someone mentioned kind of with social media how there are different ways to express different things, right? And there's art and different ways that we do express creativity. So that's actually an important part of our wellness as well. Financial, someone mentioned, right? Like we need to be able to have money to take care of ourselves in certain ways. So having that satisfaction helps us achieve financial wellness, social wellness, being connected, but most of all, feeling supported. With a lot of folks that I work with, they may know people, but they don't exactly feel supported by those folks. So that's important. And spirituality, I think we also talked about that well, searching for meaning and purpose in the work that you do, in the way that you live your life. Any questions on that? Okay. So now on to the fun part. So you all have what I call a basic self-care wheel. So underneath that colorful sheet, there are suggestions for self-care ideas. But what I wanted to highlight are the 4 diamonds on the outskirts. So in my work with particularly BIPOC clients, I've found that there are common themes that come up when we think about self-care. So one theme is feeling free to express things, feeling free to take care of yourself in however manner you need to. So that's a tenet that I've seen, as well as strength. Not only physical strength, but also feeling emotional strength. Having the competencies and capacities to connect with people in different ways and feeling capable. This came up in one of our earlier sessions, but this idea of love. How are we getting love to ourselves every day? So for me, if I go for my own physical self-care, me working out is an expression of love towards myself. So that's something to think about. And then the last one is honor. Sometimes I've seen this come up with clients where they've said, I want to honor my ancestors. I want to honor the folks who came before me. I want to honor the lives that they lived and put aspects of their culture and my culture into my self-care. So that also can be important. Okay, so underneath both those self-care wheels, there should be a wellness and burnout assessment. Now, this tool is very short, and that is intentional. If you want a longer assessment, there are a bunch of tools. I'm happy to email that. But I wanted to kind of give you something that maybe if you wanted to use with clients, if you wanted to use with your team, it would feel accessible. So feel free to take about 10 minutes to fill it out or reflect on it, and then we'll come back together. All right. So I'm gonna give Kevonya a second to talk about these oils real quick. Since folks are interested, go ahead.
Okay, so my master's degree is in integrative health. So when I say that I'm really a hippie person, I am. I went to nursing school, but then I realized that medicine was missing something. And integrative health is the thing that it's missing. And so the oils that are on your table, each of them represent a chakra, right? Which is a energy medicine that is used in Eastern medicine. And so smell the scents. If there's a scent that appeals to you, then that is the scent that you need, right? So there was an example at the table where it's like, oh, I didn't think I liked the heart chakra one, but the more I smell it, the calmer I feel. And that's because your heart is hurting and you need that. You need that nurturing. When I feel very unsettled, I use root chakra. If I'm just feeling really unsettled, if I do my root chakra oil, I get grounded again. Yes? So sage is cleansing. Sage is cleansing of energy. And so actually before everybody came in this room, I took the sage and I mixed it in a little spray bottle with some water, and I walked around this room and sprayed sage all through because I wanted to clear the room. And so you can use sage to clear spaces, either in an oil, or you can also burn sage and clear it with smoke. And that is indigenous medicine, not mine. Yes. No, you put them wherever you want. You can put them wherever you want. I was saying that, so like when I'm feeling ungrounded and I do the root chakra one, I put in a cotton ball, and I usually will put it underneath my bra strap, snap it in the middle, wherever, so I can smell it. I also diffuse it in my home office, particularly if I know I have a challenging Zoom call coming. I am a registered nurse, and so when I worked in permanent supportive housing, I actually had a diffuser plug-in that I plugged in right behind where my patients sat, and I put lavender in every morning. I also put crystals in every corner of the room that I was in, and carry a crystal with me everywhere to help, again, ground energy, clear energy, all that. But yeah, whatever oil appeals to you, then it has something for you. And if there's an oil that doesn't appeal for you, don't feel bad. You just may not need it right now. Cool?
Thank you for that healing spotlight. You get another bracelet. Thank you so much, Kevonya. All right. So we're gonna do a quick check-in. What came out when you were doing that assessment? Did anything come up?
I'm stressed.
You're stressed. All right. Oh, I'm sorry. I'm holding on to it like I'm about to go walking. Thank you. What else?
Just to be honest, and I'm kind of smiling with this, I did it, but I don't know if I was truthful with myself when I did it. I mean, I did it, and I was like, middle of the road, and I know I should have been probably a little more honest with myself, and I think me personally, I do that often, like, you just make it work, and middle of the road.
That kind of goes back to what I was saying about those stages of burnout, right? When you get to that, that chronic stress, you're like, I'm not that bad, right? Thank you for sharing.
I'm Dante. I think I answered these. Each question, one was like, I answered it in like my professional capacity, and then the next one, or some of them I asked in personal capacity. So I kind of got like blended, but I answered them truthfully. But the ones that are personal are more like neutral or to the left a little bit, and the ones that are professional or to the right a little bit. Like, it says, I felt in control or capable. I answered that in a professional sense, and I said often, right? But some of the other ones, like I've been able to engage in practices that are important to my well-being, I put rarely, right?
Okay.
So, I mean, I'm doing great in work, but maybe not in my personal life.
That's a great point. And yeah, another reason I kept this assessment short is because you can use it for various aspects of your life.
Okay.
And then, thank you for that. And then you could go ahead and see what kind of specific interventions do I maybe need to focus more on. Because I do notice, especially for high achieving folks, it's, hey, professionally I'm good, so I must be good all the way. And sometimes that's not entirely true. Yes.
How can you balance like when you're like burned out and like you still like take the time off to like relax and like deal with whatever you're feeling, but if you come back to like the professional setting, you're still burned out. What does that mean?
Ooh. So what I heard, please correct me if I missed something here, is that you take a break, you take time off because you're burnt out, and you come back and you're still burnt out. How do you deal with that? Yeah, so you may have to ask yourself a few questions here. First off, the first time you do that, right, you may still feel a little burnt out because it's not a habit yet. So I think it would be important to evaluate it over time. But the other part of that is, what are the other factors that are influencing that burnout or reinforcing the burnout, right? I talked with a few of you during the break, and that was something that came up in terms of if we're working within a system that reinforces these high expectations, then if we don't have those boundaries, it's going to be difficult to get to a sense of wellness and move from burnout.
Kind of going off of that, when I was filling this out, I was reflecting. Honestly, I've just come back from vacation, so like I haven't even been back to work yet. So I'm like, oh, okay, I'm good. But I was like, but I haven't, like, very similar to what like she was asking. I was like, is this really a true assessment of me all the time? Because it's like I'm coming back from a break, you know.
Yeah,
So.
yeah, and what was the quality of the break too, right? If you were able to completely leave work at work and just enjoy your break, then you might feel a little differently as compared to if you had to answer some phone calls and things of that nature too. Yes.
I think more than anything else is definitions, is that I had to challenge myself similar to what you told up front, is that am I being honest with myself? So what's the true definition of self-love? Because I'm not sure I got one. And, or at least one that's resonating with me right now. So that in itself is indicating that there's something that I need to work on. The other part of it is that I think that when we're in these spaces and we're focusing on it, there's some challenge in really hearing what this is saying. And there is a piece of it that goes, I just want to make this a little bit nicer visually,
Yep.
when reality is different.
Yes, thank you for sharing that. The self-love piece is something that we'll talk about a bit. I think part of that work is how do we nurture ourselves? And like you said, how do we define self-love? Sometimes if we haven't had that given to us, then sometimes it's hard to internalize it and figure out what that looks like for ourselves. So sometimes the work is defining self-love for yourself in order to figure out where you are with that. Anything else? All right. Okay. So these were just a couple of thoughts to take away here. So we talked about how stress can potentially be helpful or it can be harmful. More often than not, it's harmful. And it impacts every individual differently. So it's important to reflect on what types of stress are happening within your life and how that's impacting you. Paying attention and caring for our own bodies can be a reminder that we own our bodies. So kind of going back to what I was talking about with freedom, it's important for us to take back things, right? So if I work in an environment that says I have to be out in the field, I have to have these many hours of productivity, then how do I decide how I take that back? How do I get to ground myself if people aren't telling me that I can? So that's something to think about. And then we talked about differentiating stress levels and environments of stress to determine your self-care needs. Anybody else taking away something different? Okay. Alrighty. Okay. So I briefly mentioned the importance of paying attention to our bodies. We talked a lot about the indicators of stress. And so I thought it might be helpful to do an activity where we can just spend time in our bodies. As stated, you can do whatever you want with it. If you decide you just want to sit, that's fine. If you want to stand, that's fine. If you want to go to the lounge area, that's fine too. But I did like this one just because I think he has a very gentle voice and it's very guiding. So feel free to participate in whatever way feels best for you.
Welcome. I'm very happy to share you some meditation instructions. spine straight.
Oh, sorry.
Roll.
Oh, sorry. Sorry, y'all. Here we go.
Just close your eyes like
Wow. All right. I'm not gonna touch it.
welcome. I'm very happy to share you some meditation instructions. Okay, now first is, it's very simple. Please keep your spine straight. Just straight, but don't worry too much about it. Perfect. Stay there. Perfect. Just keep straight. And please close your eyes. Just close your eyes like you're asleep. You don't have to close too tight or any special way. And relax your muscles in your body. Relax muscles in your head, forehead, face, ear, cheeks, throat, upper body, arms and hands, lower body, and the legs and feet. Just try to relax. Yet, spine stretch. And a little bit bend your neck forward. Little bit. That's almost like the weight of your head rests on your neck. You can effortlessly rest each part of body on the one below. And this way, you feel like resting, but there's some strength. So you can find balance. All the part of your body is resting. One top of the ear, one top of the other. At the same time, it's kind of staying within you, your spine straight. Sometimes you feel like a little bit grouchy, and just feel sometimes some sensation. Just let it be. Whatever feeling in your body, just aware and let it be. When I was young, my father used to tell me that let your body on the cushion and let your mind in the body. It's like join body and mind together. Your mind come to the body, just aware of your body, and aware of any sensation, feelings in your body. Pleasant feeling, joy, bliss, or unpleasant feeling, tight, pain, or neutral feeling, maybe tingling or no feeling. So any type of feeling, just aware and let it be. Okay, for a few seconds, just aware. Relax. surround of you. Maybe there's some sound or any smell or any sensation at your room temperature, little bit hot, bit cold, any noise, people are chatting, or car, train, or airplanes moving around, or your neighbors making noise. Anything. Just aware. Just know. Just recognize there is sound. And your awareness become more open and more vast. Stay there and aware of any phenomena for a few seconds. Now you can expand your awareness even more further beyond your immediate surrounding. Feel the space around you, above you, and aware of that space. More further down. All the phenomena occur in space, changing in space, dissolve back into space, like clouds. They come into space, remain in space, they dissolve into space. And now you can even more expand your awareness. Go beyond the clouds. Space, which is boundless. Space, which is open for all directions. Everywhere. Be there. Don't worry, you're not going to get lost. Stay there for a few seconds. Okay, now, please slowly open your eyes and be present here. Just rest your mind. Not only.
All right. If you're still in outer space, come back. How did that feel? So, relaxing? Nap time. See, next time we'll have to have little cots out.
Smell my
Oh yeah, you are in the whole zone there. Yes. What else? Yep. Uh-huh. Yep. Yeah, there are so many different types of deep breathing, box breathing, diaphragm, a lot of different exercises, and all on YouTube, so very accessible. Anybody else have any other experiences? Huh? Yeah, yeah, because we have a lot of distractions, so it's hard to be present sometimes. Yes? Yeah, like I said, I love his voice, but I also love how he brings in like his childhood experiences, which we're going to talk a little bit about. But when I think about self-love and self-nurturing, I like to think of my inner child. And for me, it helps when I'm doing meditation to practice in that way. Did anyone find it difficult to sit still? Yes? Yes? Uh-huh. Uh-huh. Yep. Uh-huh. Mm-hmm. Uh-huh. 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 Yeah. So that release, and that's why I said at the beginning, however this flows for you, that's how it flows. Some folks were falling asleep, yeah, because your mind is letting go. It's actually, your nervous system is calming down. And that can be weird, especially when it's like, oh, we're supposed to be doing this activity. But mindfulness is not about pressuring oneself. It's about actually letting go a bit and letting things come and go as they need to. Did you have something in there? Uh-huh. Mm-hmm. Yep. Yep. Oh. Mm-hmm. Uh-huh. Yeah. 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 So I love that you made that practice what you needed it to be in that moment. And yeah, he still had the gentle guiding, but it was really about you taking what you needed. And so, congratulations, you all. That was about 9 minutes. So, kudos to you all. And I know sometimes we don't have that much time. Sometimes it's maybe 2 minutes. Sometimes it's taking deep breaths. But these are all exercises. And there's another one that you all will have access to. It's a 5-minute one that you can try and see what works for you. But the important thing is to practice it so that you do develop that awareness about what's happening within your body. And to someone's point about when we're stressed and it's hard to stop thinking, mindfulness helps us with that. Not that it tells us to control it, but rather we can let go. We don't have to control it. Yes. Yes.
I teach meditation with people that have experienced homelessness, and often, not just for the people that experience it, but also the providers, to have some physical release before you do the meditation. The yoga practice, like even just a technique in the sitting or doing something to stretch the body first
Yep.
for a couple of minutes to just clear. And I think that's just fine. Because for a while when I was teaching meditation in the beginning, I wasn't really practicing it. I was kind of following the script or listening to the thing. But then when I was able to do that in the beginning, it helped a lot to relax the nervous system, especially if you're working.
Yeah.
Because you're kind of on. But to take that couple of minute break in between people really does a service to them so I can show up. I mean, we're our greatest resource in the clinic. I don't care what kind of technology you have.
Yep.
The human interaction is the most important. So thank you for sharing that. That's a very real experience. I was like, I'm a teacher. And I'm like, tell me how to
Yeah, and thank you for adding that stretching aspect. I've had clients who'll say, I'm gonna work out, right? I'll box it out or whatever. But stretching and actually being mindful of what's happening within your body, slowing yourself down, the intentional practice of slowing yourself down, can actually help us manage stress better and get some clarity on maybe things that we need to maybe make some different decisions on. So, all right. I see we got a music battle going, so.
It's here.
Oh, it's right there. Okay. All right. So I'm about to have to. I'm just kidding. It's a party. It's a party. I'm here for it. All right. Okay. So we're gonna move along and talk about. We have 15 minutes. Is that real? Is that really real? Yeah. Oh my gosh. Okay. All right, y'all. So we're gonna start talking about narratives. So let's see how much we get here. I'm not gonna do that. Okay. Some more definitions really quickly. We're gonna talk about trauma here, which we're gonna briefly touch, and then we'll come back after lunch and talk a little more. But it's events or situations that have lasting adverse effects on an individual. So we're gonna talk about the ACEs, the adverse childhood experiences, but we're also gonna talk about some emerging research around the other side of that. Because we often do find, especially in BIPOC communities, that there's a big focus on pathologies and PTSD and things of that nature, but there are actually protective factors that we also have as well. So I want to spend some time talking about that. We'll talk about systemic racism as part of trauma, and essentially we're going to talk about those processes where we know something's off, but we kind of say, well, this is how it is, right? Like, no one's blatantly saying it's because you're black, but when we don't see people of color in leadership positions in our workplace spaces, systemic racism. So we're gonna discuss ways to name that and advancing our wellness and also advocating. And we'll talk a little bit about health equity, which basically, I don't really like this definition, but according to the U.S. Department of Human Services, it's the attainment of the highest level of health for all people. So essentially, shouldn't matter who I am, I should be able to attain great health. I should be able to have health outcomes not based on my race, my gender, any of those isms that we talk about. Okay. So the implications of trauma on health, there's a lot more than these, but really what we see is kind of similar to that chronic stress. When we have trauma and we have complex trauma, which is basically multiple levels of trauma that happen, my clients like to describe it as sensing things are connected, bad things keep happening, and even in other situations, that's that complex trauma. We see that it's hard for folks to remember things. It can also feel like folks have to be on edge. When I first started meditation and processing my own trauma, it was that nerve. It was like I could not get myself grounded. It was always, I have to be on, I have to be ready. And so there's a hypervigilance that sometimes comes with that. And we see the health outcomes that come if we don't actually find a way to process that trauma and develop a new sense of meaning around what's happened to us. So we see increased incidences of diabetes, stroke, cancer, liver disease, lung and heart disease. And that also then adds another layer of trauma. So if we don't do the work of changing the meaning around things that happen to us, we are more vulnerable to experiencing more trauma that's negatively impacting our health. So trauma is different for every person. And Dr. Gabor Mate talks about, in his book, I believe it's called The Myth of Normal, what trauma can look like. Some folks will say, well, everything's traumatic, but that's not true. Every person has individual experiences with trauma. So he puts a couple of things to think about to determine if things are traumatic for you. So basically, does it bring you to compulsively self-soothe or stimulate by any means to avoid it? Does it limit your capacity to think, to feel, or trust yourself? A big one that I've noticed is the sense of shame. Does that come up when you think about this event? And does it impair your ability to enjoy your life? Okay. So, I'm gonna go. You're right. That's why I was like, let me go ahead and we're gonna go back to that. But we'll go back to it. But I did want to start talking about the adverse childhood experience. How many of you are familiar with ACEs? Most. Okay, cool. All right, so briefly, 1995 study conducted by Kaiser Permanente and the CDC to basically look at trauma. And they found white, straight, middle-aged men primarily as the population in this study. And so these were a few things that came up, but we also added other things over time. So emotional neglect, invasive medical procedures, so body trauma, poverty, lack of social mobility, incarceration, environmental trauma. So I was reading an article that talked about Flint, Michigan, and how those citizens experienced trauma, not because of necessarily the environmental aspect of it, but more because they could not trust the government to do what was needed to be done. So, once again, systemic things coming into light here. And over time, these things tell us we have to be on, we have to be ready to fight, we have to be ready to flight or avoid things, we have to be able to fawn, right? So sometimes we end up trying to people please so that we can be okay. But all of those things are ways that we've learned to adapt to some really terrible things happening to us. And I see that a lot in my own life with my own family, but also with my clients and how they continue to experience these things. And it's not that those childhood experiences ended. So it's important to look at how these things that happen in our childhood still impact us today, and how, even if we have blocked them, they are still a part of what we see in our work sometimes as well. So there has been some emerging research on positive childhood experiences, or PACEs. And this goes to speak to the empowerment that we have within to determine what strengths we have based on some experiences that we've had in the past. So they found, so this is Seagay and Brown in 2017, that supportive relationships, living, developing, playing, and learning in stable environments, as well as feeling connected and having access to socioeconomic stability, helps us move forward in our lives. They also found that access to medical and mental health care also helps. I put an asterisk with that because I think it depends on who is providing that care and how they do that. So those are things to keep in mind. What else do you all think would fit into this category? Yes. Sense of community? Okay, thank you. Anything else? Is there something that maybe stands out from your own childhood? Yes.
Being able to see yourself in people who are successful. Like role model.
Yep. Role modeling, mentors. Yep.
But people who look like you.
Yep. Representation. Yep.
I noticed that there isn't anything about spirituality.
I was going to get to that, but yes, absolutely. Can you say more to that?
Like having having a strong religious belief, maybe just religious belief.
Yeah. Having a sense of purpose, and often religion does provide that for folks. Yes.
I feel education plays a big piece in that too. When you're being educated, having, like she said, someone who looks like you teaching you, and being able to see yourself in that person and having that understanding.
Yep.
So I think education should be up there also too.
Yep. Absolutely.
I just want to speak on that. A lot of people are not educated by people that look like you. It depends on where you live at, because like where I live at, that's just not the case.
Right, but I'm saying that would help with a positive childhood experience.
Yeah.
Educating in a way that actually amplifies a child's natural talent. So, like, I have always believed I was really bad at math, but I had a math teacher that actually took the time to figure out. He was like, I know you can do this. And so he was like, we just need to figure out how to teach you to do this. And so the standard, that cookie cutter way,
Yeah.
cookie cutter crap, that cookie cutter way that we approach medicine, education, and so many other things, doesn't fit all children.
Yep.
And it doesn't get acknowledged or seen.
Yep. So person-centered interventions and education. Yep.
I would go so far as to say that there's a difference between, my mouth is big enough. Education is kind of I receive it, but am I learning? So having my learning, am I learning? Learning is experiential, it comes out, and that is the part of the positive experience.
Yep. So the environment, right? That's what fosters the learning. Yep.
There was one right here.
Oh.
It's kind of included up there, the opportunities to explore safely. That could mean lots of things, but for me, when I'm thinking about like positive stuff from my childhood, both either like with family or even an educational sense, is giving children a space to connect with like the earth and like being outside, being in different like nature spaces that allow you to like understand the world better.
Yep. Absolutely.
And to add on that, like in foster care, I had never been outside of I grew up in San Mateo County in Santa Clara County, so I grew up in East Palo Alto and then predominantly like San Jose. But where I grew up was just poor areas, and I never really went outside of those bubbles. And then I had a probation officer who became my foster mom, and she took me to Mexico, and that changed my life. Like, just the perspective shift, like, was like, well, damn, I do have some things that are going on in my life, but some of these kids are happy and they don't get to go to school for free, and they don't get this and they don't get that. And so that perspective change, perspective was super important for me, but just experiencing that changed everything for me, right? And so, like, trying to get young people or people in general out, I think is super important. Exposure to travel, or just even outside of your neighborhood. I know there's people here that probably have never even probably been to this waterfront that live in Baltimore City, right? So that's kind of, it was like, I never been to the beach until I had a foster parent took me to the beach 20, 30 minutes down the road from where I lived.
Thank you for sharing that. And that's why I wanted to, it's called childhood experiences, but it's for adults too, right? So even if you didn't have these positive experiences in childhood, I, would encourage you to reflect on if there was anything, if there was a seed there, but even if you find there was nothing, how do you give yourself the opportunity to have those positive experiences now? Yes.
One that I was going to address was, I'm kind of blind even with the glasses, but I don't think I see control, but I know when you're a child, you're dependent on others to guide you, take care of you, and some people do or don't have that, like growing up or even when you get older, because you have that lack of control. When you get older, you kind of overcompensate by needing to be in control all the time. And I think that kind of lends its own layer as far as the stuff we're talking about. But also, like suppressing certain emotions, because when you're younger, we're only introduced to a few emotions or being allowed to experience certain emotions or share them. We're taught like only sadness or mad, or based off of if you're male or female or what have you. You know, certain ones are expected or non-expected of you to have or express, and I think that plays into it too, of being open and comprehending like the different types of emotions there are, and you know where that shows your house. Like if you grew up only seeing your mom cry and your dad be angry, or vice versa, or you know if you get mad or sad, are you punished for feeling those ways? And that takes a big toll on how you show up as an adult, and how you like breathe in other people that do those things. Like, you know, the people are mad at me all the time because I'm this way or that way, or I can only show this emotion based off of my childhood trauma because that's all I know. So I think being able to not only control that or, you know, exercise those emotions, and what was I going to say? Yeah, harboring them versus suppressing them is, yeah.
Yeah, thank you for bringing that up. So a way to take back our power is to be able to express our feelings and giving ourselves permission to have baby feelings that weren't allowed to be expressed as a child. In a healthy way. Thank you. I know we are at lunch, but I want to say before you all head out, first off, thank you so much for sharing. Also, if you have time, you come back a little early from lunch or whatnot, the next thing we'll be doing is working on a vision board. So all the materials are over there. You can start, you can come back whenever, at 12:30, right? But if you come back early and you're like, oh, I want to start working on that, you can do what has happened to me if you want. How am I drawing meaning from that? Where would I like to go? You can do any of that. So I think that's it. Any other announcements? Okay. Thank you all so much. Oh. Thank you so much, y'all.